Everyone, we we will get started in just a moment because people are still entering the room, but we are so glad that you are here with us today. Again, we will start in about 01, whatever the hour is for you. Okay, I will go ahead and get started. Looks like people are slowly coming in, but welcome everyone to our summer webinar. My name's Josie Badger, and I am the co-director of RAISE, along with Miriam, who you will hear from shortly. Today, we're going to have a discussion about healthcare transition. And this webinar is stepping forward, stepping back, how parents can support youth who are moving into adult medicine. This is often a really tough time for youth and families finding the right doctor and the right care. And we have worked with both of our speakers, Nikki and Rachel, for almost 5 years. And so I'm excited to have them share with all of you. Go ahead.
Hi, good afternoon or good morning, depending on where you are. If you're on the West Coast, it's morning. My name is Miriam Aliso. I'm also from the Race Center, the other co-director with Josie Badger, and I am gonna show you how to interact with some of the Zoom features. We have closed captions provided by Zoom. To use closed captions, click on the CC that appears on your screen. Typically, you have to go to More and then click on that. And we have Q&A activated for this webinar, so it's better to use Q&A for questions to the presenters. Use the chat if you have any technical issues or anything, or um, any any question for the panelists, for us. And we also have interpretation to Spanish. Tenemos interpretación al español para hacer uso del canal en español. Van a ver en la banda o cinta negra un globo que indica Interpretation. Haga clic allí y luego seleccionan español y oprimen donde dice Mute Original Audio. Esto último filtra completamente la señal en inglés para que puedan escuchar con claridad a nuestro intérprete de hoy, que es Luis. And we also have live American Sign Language interpretation. We have pinned our interpreter, Dina, but if you want to pin yourself, click on the three dots next to the picture of the camera of the interpreter, the ASL, and you can pin Dina. And then go back to you, Josie, or to Nikki and Rachel.
I'm fine picking up here. Thank you. And
Great.
we're excited to be here to present to you all. Our objectives for today are just that by the end of the session, you'll understand first what we offer at the Center for Transition to Adult Healthcare for Youth with Disabilities. We want you to understand how the roles change and how the rules and laws change as your child moves from pediatric to adult healthcare. We want to talk a little bit about how youth can lead that process and how they can be leaders in their own healthcare transition. And finally, how families can support youth learning what they need to know during the transition to adult healthcare. So I'm going to introduce myself a little bit, and Rachel's going to introduce herself. Rachel, I will hand it to you first.
So, hi everyone. My name is Rachel Shandler, and I work for SPAN Parent Advocacy Network as the Youth Engagement and Empowerment Coordinator. So I'm coming to you as that, but I'm also coming to you as a person with a disability herself. I have cerebral palsy, and I navigate the world using a motorized wheelchair. So I have a little bit. I have a lot of experience with transition and healthcare transition to adult life and things like that. So I'm hopefully going to share some of that with you today.
Thanks, Rachel. And I'm Nikki Montgomery. My professional role is that I'm the Director of Strategy and Communications for Family Voices National. I also help to lead the Center for Transition to Adult Healthcare for Youth with Disabilities. And my personal connection, I have a few of them. First, I grew up as the sibling of someone with a rare genetic condition and disabilities. I grew up as an autistic youth myself. And I am parenting a child with a rare genetic condition, multiple disabilities, and autism. So I come with those three lenses of lived experience into this work. And Rachel and I are excited to share all the work we did together to help
Yes.
build this center and support the youth in this center. All right, Rachel, I will hand it over to you.
So first, we're going to talk about what is healthcare transition. So the definition of healthcare transition is the process of moving from pediatric to an adult a model of healthcare. And there's all different kinds of health. There's all different kinds of transitions, not just healthcare transition. There's transition from adult life to elderly life. There's transition from high school to college, college to dorm to move um college dorm life to like living in your own apartment. There's all kinds of transitions, but what I like to say is that healthcare transition is just as important as any other transition to adult life. Um, and sometimes more important because if you're not taking care of your health, the other things that you're trying to do when you're transitioning to adult life can be hard because if your health is lacking. So healthcare transition is just as important as any other type of transition. And it's something that's not talked about much. That's partly why we started this center. And um, that's why you'll see the How Do You Know fact less than 1/5 of youth with intellectual and developmental disabilities receive all the services needed to move to adult care. And that's kind of shocking. And that's another reason why we built this center and, these tools so that we can um, kind of solve that problem or help with that problem and make it better.
Thank you,
And
Rachel.
oh, go ahead. Sorry.
Go ahead.
Oh, I was just going to say you can learn more about our data profile at Moving to Adult Healthcare, which is our website. That was the last view.
Thank
So
you.
next we have the Center for Transition to Adult Healthcare for Youth with Disabilities, and that is our website that will hopefully show you in a little while. But the the website and the center was created most importantly by my favorite people, the youth. They were at the forefront of all of this, which was really awesome. But we also had partners, including Family Voices, Got Transition, SPAN, UMKC, and the Weisman Center. So
And so
Nick,
with,
go
oh,
ahead.
go ahead.
You're fine, go ahead.
All right. Well, with this center, it was funded by the Administration for Community Living, which is a federal administration. And the center was designed to really make sure that youth could move from pediatric care to adult care with no gaps in service. And what typically we learned happens is that when youth move to adult health care, they kind of fall off a ledge. And so they may show up at the doctor and their insurance doesn't work, or they may show up at the doctor and the doctor is no longer able to serve them. And so that can create a big gap in the care they're receiving and the continuity of care, which can cause health problems down the line. So the goal that ACL set out for with us was to make sure that youth had as smooth a transition as possible from that pediatric world to the adult world, and that they did not miss out on needed services in the process. All right, Rachel, I'll give it to you to talk a bit about youth leadership.
So working with the youth is primarily what I did in my role in this whole entire project. So we worked with youth with intellectual and developmental disabilities. The first group of youth was an older group of youth who we called the Youth Steering Committee, which were between the ages of 17 to 26. And they worked on projects that we'll talk about a little further, like in a couple of slides, including the website app and toolkits, and they also worked on a project um, called the Youth Development Initiative, which was an advocacy project where they worked with a younger group of youth, which you'll see on here is called the Youth Development Initiative, which was between the ages of 12 to 17 years old. And that project was created so that we could teach a younger group of an older group of youth. The youth steering committee could teach a younger group of youth, the youth development initiative, about things like advocacy, health care, and health care transition. So that project was actually one of my favorite projects because I felt like it was very youth driven. The youth steering committee created like all the PowerPoints that were created for that training. All they presented everything. So they did everything from like creating the trainings from top to bottom to presenting. So that's why I felt that it was really youth driven, which is what we wanted for the whole entire center and all these projects. So and also so that project, the other thing I wanted to add, that project along with the other, well, that project was like a mentor. The youth development initiative project was a mentorship project. So older youth was or younger youth was learning from older youth, and they were the younger youth were being mentored by the older group of youth. So and the rest of the projects with the youth learn life skills and mentored others. So yeah.
Thank you, Rachel.
You're
Um,
welcome.
we had a great time developing the products that the ACL asked us to develop for this project, and we did work with youth all along the way. So one of the first things we did was some real research about what is out there for healthcare transition for youth with intellectual and developmental disabilities. We had a research team research articles, research peer-reviewed journals to find out what we know about healthcare transition for youth with disabilities. And we looked at different disabilities. We looked at different ages of youth just to find out what was stopping them from transitioning smoothly and what could help. So that was our starting point, was really to dig into research and dig into finding out what is out there in the first place. And that took about a year with the research team, and they published a report on that. That report is available at movingtoadulthealthcare.org. There's a data section on that website, and you can read what those barriers were. You can also read how the youth interpreted those barriers and added to that list. So we went out and did the research, and then we had youth look at what we found to say, is this right for you? And they actually added a lot of things to that list that we didn't know based on their own lived experience. So just navigating office spaces when you have a wheelchair was a major issue. Not being able to find a doctor who would provide care for them. Those are the kinds of things we learned in the landscape analysis, and youth really helped us to define what their experience was of the barriers. Another thing that we've developed as part of this project is an annual data profile on healthcare transition for youth with disabilities. So every year we look at the data from the National Survey of Children's Health, and our team members from Got Transition lead this part of the project. They find out whether youth with disabilities are experiencing all of the pieces of care they need to transition to adulthood. So that is whether or not they spend any time alone with their doctor. Whether or not their doctor works with them on building skills to manage their care as adults, whether their doctor asks them about moving to an adult provider, and those kinds of things all together make a smooth transition to adulthood, and also whether or not they actually make that move. So all of those pieces go into our annual data profile, and we've seen over the past 4 years that it varies. Some years are a little better than others, and right now we don't know why it varies so much. But the goal of this project is to make sure it doesn't vary as much, and that more youth, more than that, less than 20%, actually get all of those parts of healthcare transition so they can move smoothly into adult care. Another thing we really worked with youth on were developing curriculum kits. And so we have these booklets, which we'll share a little bit more about what's in them later, but they're booklets and tools that any family can use to help their young person move through transition. We actually have parts of the kit that are made for youth with lower reading levels and some that are made for youth who may be able to work independently through the booklets. We have sections that families can help participate in, but those curriculum kits guide you through some of the key things they need to know in order to move to adult healthcare. And these were also co-developed and co-designed by the youth that Rachel talked about in our youth steering committee. They told us what they needed to know. They told us how we could present that information. And so those curriculum kits are designed partially by the Life Course Nexus, along with the youth in this project. The next couple of pieces are a little more technology driven. We were assigned to create a website that houses all of this information and a mobile app. And youth told us what they wanted the website to contain, how they wanted it divided and split up so that there's a section for youth, for parents, and for their healthcare providers. They told us what colors they wanted the website to be, and the purple on that website was definitely their doing, and they
Yeah.
advocated for what the website should look like. And
I
even with
truly
the,
think I
go ahead.
truly think that sorry, I was just gonna add, I truly think that the website was one of along with the YDI, but the the website was I think that was one of the youth's favorite projects to do because it was really youth driven. But go ahead,
It
Nikki. I
was.
just wanted to add that part.
Yes, and even for the mobile app, while you have to sometimes hire like a developer to do the mobile app, they told us in the first year of the project what things they wanted included in that mobile app and what that should look like. And we took their recommendations and we gave all of that to the developer to help develop the app for this project. The mobile app is still in its testing mode, and so there are families who are going through a 10-week process of testing the app so that we can release that and other families can have the benefit of what we learned in this project and have a benefit of having all of those tools at their fingertips. And finally, one of the big products we had was an ECHO training for healthcare professionals. And if you're not familiar with ECHO, it's case-based training. So you actually come in with a case study and work through how to support that youth through their needs during transition. And we did 2 years of ECHOs with the Waisman Center. There's access to those on our website. So if you have a provider that you think would benefit from learning from what that professional education looks like, it's for any healthcare provider. And they can look back at how to guide youth through healthcare transition. So that was a big project. Youth actually participated on the faculty team for the ECHO as well. So that youth leadership has moved all throughout this project, and we are really excited to be able to present something that was truly youth driven. And Administration for Community Living really wanted it to be youth driven and told us that from the onset. So a lot of our work was starting to define what youth driven looks like and make sure that youth had a voice in every part of the project. So we're really proud of that, and we're proud of the products that we've come up with, and we'll share more of those with you today. But I think what you'll find is that we did a lot of work to make sure that the tools would be relevant for young people and usable for young people, regardless of their ability level, so that their families could help them move into adult care really smoothly. So I'm going to get into a little bit of healthcare transition and what changes. Um, it's a big change in life, right? And so transition as a whole, as Rachel mentioned, can be about you transition housing. You're moving from high school to post-secondary or vocational or something like that. And so there's a lot of different changes that are happening at that age 18 timeline. And healthcare is one of those major things that can change. So you may not have the same access to your child's medical records that you used to have, or access to their portal. You may have your child needing to have exercise their own rights and call in and make appointments, or do that with support. And so some of those things that shift, families have to take a step back, as the title of this webinar indicates, and allow that youth to step forward. And also when we think about that, it goes beyond just the legal requirements and changes. It really goes into what your family expects out of adulthood. So that can be cultural. A lot of us have different ideas about what adulthood looks like. Do you, throw the birdie out of the nest and see if they fly? Do you, keep propping them up for a while? A lot of that is different family to family. And so we have to define in our family what is the role of the parent and what is the role of the youth at this age. And how do you start to shift that if you have a different idea than what is happening at that moment? So support may be different for some youth, and they may require support throughout the course of their lifetime. I'll share that my teenager is 14. He'll be 15 in a couple of months. And my thought right now is that he may spend most of his life living with me. I could be wrong about that, but there are things that will have to shift, and I do have to start to let go a little bit more at this age. It's hard to do. And I think one of the things to think about as a parent is we are so used to guiding their health care along with everything else in their lives. We are the repository for all of the knowledge about their health sometimes. So I know all my son's surgery dates throughout his life. I know what medications he's taken and which ones didn't work and what foods work for him and formulas and all of those different things that are a part of his very complex care. And it's time for me to be making sure that he knows those things and he can advocate for those things. So really that role change is one of the major shifts that parents need to make during healthcare transition. And sometimes that's the hardest thing to do. Many times our youth are ready to step into those roles and they really want to, but we might hold on to the reins a little tighter than we need to at that point. So I think that's an important piece I want to share with you all. And I'm going to talk a little bit next about how those roles shift over time. So you'll see this chart here, and this came from an adolescent health transition project some years ago. But it starts with looking at the roles here and how they change over time. We start off with the parent provides care, the youth receives care. And often that's been a long pathway, right? From their infancy on up, that the parent is the one giving the care, directing the care, talking to the providers. And the youth is often a recipient, sometimes really passively, at that phase. When we shift a little bit, parent starts to be the manager, but not the only person doing the care. So that means the youth can provide some of their own care. They get to maybe change their routine and decide when they're going to take their medication. Maybe they get to do a couple of additional tasks like call in their medications and prescriptions or order their own supplies, those kinds of things that you can hand off. And the parent's role then is to step back and help manage that. So maybe you're giving a reminder. Maybe you're providing them the phone number to do that and guiding the conversation. My son, who is 14, started checking himself into his medical appointments when he was 10. So I step back. I let him, he uses a wheelchair. I let him drive up to the desk and he introduces himself. He gives his date of birth. He tells what his insurance is, and he initiates that process. And I had to, of course, give him a script. I started with a piece of paper that told him the things he needed to say because he didn't understand insurance or any of that. But it was an opportunity for me to manage that process and help him learn it. And he got to provide some of that, and he felt really proud of himself, too, to be able to check into an appointment or something. So we go from the managing and then the youth providing some of it. And then this is where the big flip happens. Instead of the parent managing, the youth becomes the manager. And the parent is a little bit farther back. They step a little bit back and they are the supervisor. So I think of it like almost a factory floor. And now you're not on the floor with them. You're like stepping back and supervising the whole floor and they're managing. And I will add, not every young person will be able to manage every piece. So what can your young person manage in their care? So my son manages checking to make sure he's done all of his care routines, his activities of daily living every day. Have you taken your morning medication? Have you had your grooming that you need to have? That's what he manages every single day. And so I can supervise and say, did you forget anything in your routine today? But I'm stepping back and letting him lead more in that way. He doesn't still understand all all of the nuances of insurance. He doesn't remember his whole medical history, but those are steps that we can move toward where he can look at his medical record and he can start to see what's in them. So it's not just me managing all that. But right now, there are parts that he manages and I supervise. And then not finally, but next, the parent is a consultant. So ideally, the youth is managing their care to the best of their ability. And they might chime in and say, hey, I need to see a specialist. Can you help me figure out what I need to do? So then they're consulting the parent instead of having the parent be the ones governing and controlling the entire process.
I
And so
think
he
that's
might
where
say,
I'm at now.
that's where
Like
you
the
are. Okay, tell us a
consulting
little more
was
about that,
bad. Yeah.
Rachel.
Yeah. So my situation kind of happened in like a weird way. Like my family used to like help me make doctor's appointments and all of that. And then my mom would start making the doctor's appointments when I had other things to do, like work things or other things. So she'd be like, "Oh, I made this at 5 o'clock," and I'd be like, I can't I can't do it. So then she would we would talk about it and then I just was like, I'm just gonna start making my own appointments. So I just started making them and now I go to most of them on my own or with a caregiver because sometimes I do bring someone with me just because I feel more comfortable. I don't know. But my parents don't always come with me to every appointment, but they do come, like if something happens to me that is, out of the ordinary, or I'm nervous about going to a certain appointment for whatever reason. I'm 38 years old and I know that's kind of old to bring a parent to a doctor to an appointment, but if they will still come with me, but a lot of that doesn't happen anymore. I would say I'm more in the consulting phase, and that just happened just because I was like, I don't want you, I don't want you guys like making you're messing this up, and I would be like, so I just started kind of handling it on my own, and but there was not really, we didn't have like a sit down discussion, like there wasn't really a huge, like you were talking about a shift, there wasn't really a huge shift. Like I just one day I just was like, I'm just gonna start doing this. So and they
Yeah.
were like, okay. And I was like, good. I don't want to go to anymore. So yeah, so it just kind of happened. I don't know.
And I
There
Yeah.
think,
was
Rachel, that there's different personalities, right?
yes,
So
exactly,
you
exactly.
decided you were just going to take over and do it, and
Yes,
some young people might need to be pushed a little bit more to
exactly.
get there.
Everyone's
Yeah.
different for sure.
Yes, yes.
Yeah. And
And I,
Nikki and Mary and Rachel, there is a
yes,
question. I don't know if you're gonna go right now or
sure.
post later. This from Erin, and is Erin says this is exciting work, and I am glad it's led by the community. I haven't had a chance to deep dive into the data, but I am excited too. Does the research include information about the use of assistive technology in healthcare and daily living?
So that the initial environmental scan does have some things about that, and what we learned is that can be a barrier for youth who feel like their providers don't know how to engage with them if they use assistive technology. So yes, we do have some information about that. The annual profile does not contain that information. It's just looking across the board at any youth with developmental and intellectual disabilities, but it doesn't specify that group. But thank you for that question. Anything else right now, Miriam?
No more questions.
Okay, great.
Cool.
All right. And so, Rachel, I thank you for adding in that
Yeah,
personal touch of your own
of
experience
course.
there. And you show how you became a leader in your care. And I
Yep.
think we do have to think about shifting. It is hard for parents sometimes. It
Yes, it
sounds like
is. It is.
your parent was glad to
It took
let
a
go a little
while for
bit.
them to get to that
Yes.
point. I didn't start out by saying that, but it took a little bit. Yeah, it wasn't always like that, but it came a point to where like everyone was like, you should like you can start doing this, right? Like, and I
Yeah,
was like,
yeah.
okay, and I just started making them, and it's been fine ever since. So
Good. And I want to normalize, many of us want to take someone else to our doctor's appointment.
yes,
Health literacy is something that can shift. And so, like, health literacy is just your ability to understand and use health information for your care. And if you're under stress, your health literacy level can change, even if you have an MD, honestly. Anybody's health literacy level could use the support of having somebody there with us to just be an extra set of ears. So we're talking about doing something that we should all probably call on when we can, is to have somebody there supporting us in our
Exactly.
healthcare. Yeah.
Supported decision making.
Exactly. We can all use it. So
Yes.
ideally, we want those youth to become leaders in their care to the degree they can. And that doesn't mean it's all or nothing. And I think that's the part I really want to stress. There are parts of my son's care that I may always need to manage, but there are parts that he can learn to manage. And so if they can't do all of it, that doesn't mean they can't do any of it. And I just want us to think creatively about what we can hand off, what we can give them power and leadership in. And so that's the part that Rachel's going to start to talk about next, is just how youth can start to take that leadership role. Rachel, I'll hand it off to you
And
now.
I also just wanted to add, I mean, this is overall, but everybody's always transitioning to different parts of life. I don't think transition like ever really stops. And like, I said in the beginning of like a little bit in the beginning, I just wanted to like transition. Everybody's always transitioning to every phase of their life. There's always something changing, always something moving. So I just wanted to add that. But how can youth lead their healthcare transition? State their needs and preferences. So this is just really like stating what do I want to do? What am I capable of taking care of? What am I comfortable what with doing? What am I able to do? So related to health care, like some of these things, some of the things on here, learn about your health condition. What is your disability? What does it look like? What happens? What are the things that happen to you? What do you need support with? What are you able to do on your own? Can you take medications on your own? Do you know how to read a medication bottle where it says take this medicine 2 times a day, morning and night? Do you know how to read that? Um, can you call the doctor on your own, or do you like what Nikki was saying? Do you need a script to say what you want to say and when you want to make your appointment? What are you comfortable with doing on your own, and starting those processes early and having those conversations early. And do you need to write down the questions ahead of time that you're going to ask your doctor? Do you want to talk to a family member or caregiver to do that ahead of time, and then go into the doctor's office and ask those questions with someone there? Or do you want your parent or caregiver to be there for part of the appointment and then they leave halfway through? So what are you comfortable with doing?
And Rachel, I'll add here, I started with my son at age 5, where he had 12 specialists. So we would talk about what specialist he was going to see and what that specialist does for him. So, hey, we're going to the cardiologist today. That doctor talks to you about your heart. Do you
Yeah,
have questions about your heart? And we would write those down before he went. And he's consistently done that over the years. So even now, we talk about who we're going to see, what parts of his body he should be thinking about. And in the appointment, I will either prompt him, or now he'll start on his own to ask the questions he decided to ask that provider. And that's something you can start at any age. And I do think often we think about transition as something we should start to approach at age 17 or 16, and sometimes even like 14, like the schools do. But really, you can start building the skills that you need for healthcare transition at any point. They can learn about their disability at any point. My son's condition is called congenital fiber type disproportion myopathy. It took a very long time for him to learn how to say what
that's a
that
long one.
it's a long one. But now he's 14 and he can say it, and he can say how it impacts him. He'll say, it affects the way my muscles work, so I don't walk. Or he says those kinds of things. But learning what the name of his condition is and how that condition impacts him, learning what the names of his medicines are and how those medicines affect him. Those are things that kids can learn at any age, and you can just start one at a time and quizzing them every now and then and having them answer those questions. So that's one good way that youth can start to lead, but it doesn't have to wait until they're at transition age to build that skill.
And like a doctor's not going to know, like a doctor is not going to know every single thing about a condition. So even if they're a specialist, so that's why it's also really important to know about your condition, because then you can explain, like, if there's something that they don't know, because they might not know how certain things affect you. Everybody's disability is different. I know people where we have the same condition, but our, like, the variations of our CP are different. So the way that it affects my body is way different than somebody else's, even though we have the same exact thing. So that's why it's
Yeah.
really, really important to know your disability and be able to advocate for yourself and speak up for yourself as comfortable as that is for you.
Thank you, Rachel.
Yeah. So youth leadership in healthcare transition. So supported decision making versus guardianship, and we're not telling you which one to choose. That's completely your choice. But supported decision making is just an alternative option. And supported decision making is something that you can use to help your youth make a decision about something, and especially when it comes to healthcare, it can be really important to get support from a doctor or a caregiver or another supporter, because some of these things are so confusing and convoluted, and there's a lot of pieces to every part of healthcare, or someone's condition, or how their medicine will affect them, and it can be very confusing. So it's good to get advice from others, especially if you have friends or people that have the same condition as you. It's good to bounce ideas off of them. Say, how did this work for you? What did you do for this? Using supported decision making in that way can also be very helpful, and it's centered around the young person and their needs and desires. So what do they want to do? And that's where this tool comes into play, the life course nexus trajectory. And it's kind of small, but this is a tool that you can use to write down all those ideas. So what did you used to do in the past versus what do you want to do now? What did your healthcare look like in the past, and what are you going to do moving what do you want to do moving forward? And what do you want your life to look like? And what don't you want to happen? So those are all things that you can write down on this document to like help you put all your thoughts down so that you're ready to tell someone, or you're ready to tell a doctor what's going on, so that you don't have to just think of everything in the moment.
Yeah.
So this is
Really
just
Nikki and
one
Rachel,
tool.
Rachel,
yeah, go
we
ahead.
have a question.
Oh, sure.
And it's what to do if the person is in denial of their problem. I'm guessing, or their disability.
Hmm.
Um, I say it's. I mean, I always communication has been huge in my family. We talk about everything. We might not always have the nicest conversations, and, like, sometimes things don't, we fight or have arguments to get things out. But I don't know, communication has always been the way that I do it with friends or family, but I know that doesn't always work for everyone. Maybe talking, getting into support groups that have people have the same disability as you. Talk to other people, get on message boards, get in other kinds of groups, um, so that you can see, like, hey, this person has the same disability as me, or a disability, and they're able to do this really cool thing, like, you know, um, to just kind of normalize it a little bit.
Now,
Um,
Rachel, I would add to that sometimes, I mean, the personality of the person you're dealing with has a lot to do with whether
yes,
or not
yes,
they will
that's a really good
accept
point.
help and
Really good point.
support as well. And so I do think sometimes that might be their own mental health goals, but I think having the reflection with them of let's think together about
Yes.
what your condition is And maybe it's something you come back to over time of how does this impact your life? How do your medications impact your life? How does not taking your medications impact your
Yeah.
life? Those kinds of questions might be ones that are not a quick, like, yes and no, but are conversations you have over time to
Yeah.
help that person
Where they can
better
reflect.
understand the impact of their conditions.
Yeah. It's really, is that helpful? Is there any other questions?
No, that was it.
Okay. Thank you. And I'll move into a little bit about how families can support all the things Rachel
Yeah.
was just talking
Yeah.
about.
Before you continue,
Oh,
Nikki, there
sure.
is
Yes.
somebody who raised their hand.
Oh,
But if
sure.
Kalila, if you would like to put your question on the Q&A, or otherwise we can ask you to not mute. But
Sure.
let us know if you would like to put your question on, type it on the chat. Okay. Thank you, Nikki.
Okay. All right. It doesn't sound like the person's unmuting, so okay. I'll keep talking for the moment. Please feel free to put it in the chat and I'll pause after this so you can ask it. So a couple of the things I talked about are having your young person practice skills over time. So maybe the first time they order their medications, it doesn't go super smoothly and you have to be a little hand over hand right there on speaker on the call, right? But then maybe this is something they can learn to do in their pharmacy portal, or you can learn different ways so they can practice that skill over time and then practice like the timing of it. Do we put an alarm in your phone so once a month you remember to order your medications? And then you can step back a little bit and let them handle that themselves. Kalila, I see your hand back up. Feel free to unmute and ask your question. Is Kalila able to unmute?
No, but I allowed her to.
Okay.
Yeah.
She can unmute.
She said, they said that she didn't have her hand up. There,
Oh,
I'm not sure if she did. I think that's what the chat said.
okay. Thank you. All right, I'll continue then. In addition to practicing those skills, one thing that I have had my son do is direct other people in managing his care. So he has in-home nursing, and it's his job to make sure the nurses know how to use his equipment properly, which means I have to teach him to use the equipment properly so he can tell other people how to do it. It's his job to make sure that all of the parts of his routine are done. He's quite rigid about it sometimes and very bossy sometimes, but he does tell people what needs to be done for his care. And that is a form of advocacy that we're helping to coach him through. So he knows how to speak up for, hey, you didn't do this thing in my care the way I'm used to it being done. Can you redo that? Or let me tell you what needs to happen for me to feel safe or comfortable. When he's sleeping, he has someone rolling him. So he'll say, you need to roll me a little bit more, or you rolled me too far, or the covers are too high. But really being able to speak up for what his preferences are. It is a thing that we do as parents, hopefully to teach our children to advocate. And please understand that you will likely be the first person they practice it with. So
My
be
family would
ready.
tell you the same about my caregivers now. They'd be like,
Yes.
"Yep,
Yes,
she's bossy."
exactly. You're teaching them to be vocal. They're going to be vocal with
Yes,
you, but this
exactly.
is a skill that you need to build in them to have a healthy life in their adulthood. The other thing is really to have those conversations about care needs. So you can sometimes make like a social story for them to map out what they have to do to be healthy and well. You can have them, again, give directions and instructions, describe what happens in their care to other people, and encouraging them to have different ways to communicate that. Even if they use like an AAC device, how do they map out what the steps are in their care so they can communicate that one to somebody else? And then the other thing I encourage is to start to let go. And that pace is going to be different for every family. Sometimes you can, like I said, let the baby bird fly. And other times you're going to have to be alongside them for longer. And sometimes that is their whole lives. And so the reality is that pace looks different for every young person. but you can start to give them tasks and monitor their progress. If they are not successful the first time, don't give up. Try again. Or you may try multiple times and figure this is not the best task for them to manage. I'll keep this one and I'll see what else I can give them to manage. So they just need time and practice to develop those skills, and understand what an independent life looks like for them. And so I do also want to say independence, full independence, is not always the goal. It's not always the goal to say, let go completely. Some of us know we're going to have our hands in this for our child's whole life, and that's okay. There's no shame in that. It's just what it is. And so it is, how do we balance the power together? How do we develop our own dance so that the child feels like they are growing up and becoming more in charge and leading, and the parent feels like they can step back and not lead as much, maybe, or just supervise a little bit. And so I think helping to build those skills, having the practice, when something doesn't go well, talk about it and figure out what additional supports are needed to make it go well. So maybe they feel intimidated about calling the doctor with a medical question. And maybe that's something you want to do side by side, or do some coaching and scripting so they can do it. So there are a lot of different ways that you can help build those skills for your child and with your child, that don't involve you doing it all yourself forever. And that's a benefit for all of us, I think. For the parent, seeing your child be successful as they grow up in managing parts of their care is something you can be proud of, and it's something they can be proud of too. All right. And Rachel, I think is this me or I'm passing it on to you?
I thought that was you, but I can do it
Okay,
if you
nope,
want me to.
I'll handle that here.
Okay.
So I do think it's important to talk to your child's doctors about healthcare transition. This is something that sometimes pediatric doctors will say, oh, I can keep seeing your child until they're 26, or I can see them indefinitely. But that's not always the best idea. I'll give an example from my own life. My sister, she ended up having to go to an emergency room outside of her hometown, and she had no experience in adult care yet, even though she was an adult. And so when you go to an emergency room, they're not going to put you in peds.
Yes.
And she had to get thrown into adult care in a way that was really not good. So having those conversations and starting the shift is something that's going to be protective, as your young person grows up, and be in conversation. So even when the doctor says, I can keep your child, and you've developed that relationship, it can be hard to let go, but really starting to say, okay, who's going to be the long-term provider? Where can we move this care? And those two providers can talk to each other. The pediatric doctor can help to transition that care, but you sometimes have to nudge the doctors into moving you into adult care. And then again, focusing on that skill building, building your child's independence doesn't mean you never support them. It just means you find out where the support is needed and where it isn't. And so I think, if you're thinking about what you can do just to start, what skills can you help with right now? Just what is your diagnosis? Might be the first skill. How do you set an appointment or check into your appointment? That might be the first skill. And you can spend however long it takes for your child to develop that skill, to start that process. The other part is staying flexible, that not every child requires a guardian. I mean, by now we've all heard about like the Britney Spears guardianship and how hard it is to get out of a guardianship once you get into one. And so I do think it's important to consider whether your child needs a guardian or whether they need support. And your child may be able to, with your prompting, state their needs and desires, state what they want their health to look like. And if they can, you may not need to be a guardian, because it's very hard to undo that. Some states have laws that help with supported decision making as well, so that they have like a decision making partner on file with the state. You'll just have to know what your state requires. But I think it's important to not just believe that guardianship is the only option. And I'll say providers often may push guardianship because they don't always know all the options. You may want to talk to your local organizations that are family led on what those options are in your state. And then finally, don't forget school. So if your kid is still in school, you can add healthcare transition goals to their IEP and 5004 plan. So they can be working on self-advocacy for their care as a skill they develop in school, like they would in a health class. And so don't forget to include them. The toolkits and things that we introduce you to through this project, those can be used in school. They can be used in other settings, vocational settings. So don't forget to include those settings in making sure that your child has all they need.
And
Okay, Rachel,
also, I was just
go
gonna
ahead.
add to one thing to that. If you do it, just adding to what Nikki was saying, if you do that, then the child or the youth is getting the support in every, like, it's like continuing, like from home to school and then back again, home to school. There's no like lapse in, learning those skills. So that's why that's important. And a lot of organizations like SPAN do transition. We do webinars and trainings on transition to adult life and trainings on IPs and how to start that process of having your student learn about their IEP and starting that whole process of being able to advocate for themselves with their IEP. So um, use SPAN or Family Voices as a resource to get those trainings. Be really helpful because starting as early as you can is really important. So, starting early is really important. Again, building skills and knowledge as early as age 12 is recommended. And like Nikki said many times, don't do it alone. Use the people around you. Use supported decision making to do those things. Include all the family members of the care team to support your transition to adult health care. So when you go to the website, to look up resources. We have a lot of different resources on the website, including resources for youth and young adults, parent, caregiver, clinician, and direct service provider. But what I like most about the website, well, I like a lot of things about the website. Again, it was one of my favorite projects to do with the youth. But what I think is one really cool thing about the website is that you can go on the website and like toggle to make the resources um, be directly like what you want them to be to that specific thing. So you can do it just for youth and young adult. You can do it just for parent or caregiver or more than one. So it lets you really narrow it down is what I was trying to say.
Yes.
So
Thank you, Rachel. Yeah,
yeah.
we have multiple audiences, and as you see, there are topics like what's the introduction to healthcare transition? How do you start to become a self-advocate? How do you get ready to move to adult care? And how do you navigate like changes in legal rights and insurance? And then for the providers, we have different sets of tools for them as well. So if you want to use the QR code, that will take you right to the website, but the website is moving to adulthealthcare.org. And another thing you'll find on the website are toolkits. And these toolkits we've talked a little bit about, but every toolkit has an easy reader and a side-by-side guide. An easy reader is really set up for like reading level about third to fifth grade, where there's just a few sentences on each page that introduce a topic and help youth develop some key knowledge that they need to have. The side-by-side guide, since there are probably a lot of parents on this call, may be ideal for a lot of us because it's intended to be a partnership. And so you can either have your young person read it themselves and you support. You could read to them. There are sections that have activities where you learn together. And so you can stop and have a conversation about what it was like to move from childhood to adulthood for you, because we all have that transition in our lives. And so there are different conversation stopping points in the side-by-side guide. Those could also be used by a direct service provider who's working with the young person. So those toolkits are intended to be accessible to a number of youth, regardless of how they're coming into transition and what their needs are. And there are worksheets and tools for every toolkit that help you plan together, think about transition, write down questions before your healthcare appointments, all of these different skills that are needed. And so there are 6 different topics that help youth learn about getting ready for the change, which is healthcare transition, knowing about their own health conditions and medications, knowing about their routines and managing their health routines, understanding their legal rights, how they take charge of their own healthcare visits and lead, and then really getting ready to move to an adult provider. So the toolkits teach them all the skills they need to learn for all of that and offer a lot of different resources you can click on and learn about more. So I encourage you to download those. Those are free. You can access them on the Moving to Adult Healthcare website, and they will be available even beyond this project. So please do access those tools and start to use them. I'll tell you, I've used them myself in my life with my son, and I'm helping to teach him about what the changes are that are coming for him in the next couple of years. All right. So Rachel and I are pretty much done with what we needed to discuss. I know there are some upcoming events, Miriam, that you wanted to talk about, but we're also open for more questions.
Wonderful. Thank you both so much. I'm gonna pause and see if any additional questions have come in. Miriam or Lauren, have you seen anything?
Nope.
Nope.
No questions.
Right. And Miriam, can you go ahead and introduce the
Yeah.
upcoming?
The next slide she has. Over there. Thank you,
Okay.
Nikki.
So on Monday, this sounds so far away, but it's not. September 21st is our next webinar. It is Beyond High School, Inclusive Post-Secondary Education Options. A lot of you have already registered, but this will be another great event. So please sign up for that. And then our annual summit this year is virtual. So the first day is July 13th, 2 to 4 Eastern. Second day is July 20th, and 1 to 3 that day. Those are both Eastern time. We wanted to ensure that everyone had the ability to join, but not maybe spend their entire day. We know how hard that can be, especially on Mondays. So please join us. Those blue words are hyperlinks, and so you will get this PowerPoint and the recording. If you are interested, please click on those and sign up, but you will also be getting additional emails about them. So thank you all. Thank you, Nikki and Rachel, and we'll talk to you soon. So thanks, everyone.
Thank you.
Thank
Thanks,
you.
guys.